My name is Veronica Ajewole, and I am the Principal Investigator and the Director for the CPRIT-funded program that we have here at Texas Southern University, which is the Breast Cancer Screening and Prevention Center. And it is with great pleasure that we bring our outreach and webinar this afternoon, where we will be focusing on health disparities in breast cancer treatment for Black women. We are very cognizant that this month is Black History Month, and we are making every effort within our capacity to reach out, provide education, provide support across the spectrum of healthcare related issues. And today we are focusing specifically on breast cancer. So thank you very much for joining us, for those that are on site as well as those that are online. Again, this is Texas Southern University Breast Cancer Screening and Prevention Center. And we offer convenient, no-cost screening and diagnostic mammogram services to ethnic minority women who are uninsured or underinsured, living in Aries, Grimes, Matagorda, Walker, and Wharton County. We also provide patient navigation and barrier reduction services to enable women get to their screening. In addition to that, we provide lots of breast cancer awareness and education, which is one that we are doing today. And as you can see on the picture on the slide, we have cancer walk, we have balloon release, we engage with different entities to be able to achieve the goals of our program. So if you would like to stay connected with us, feel free to scan the QR code or text TSU Breast Center to 855-264-9031, or you can send us an email, breastcenter@tsu.edu, or if you prefer to give us a call, you can reach us 713-313-4424. Again, I want to welcome everybody for joining us. We would have a Q&A session at the end of today, so please feel free to post your questions into the Q&A box, and at the very end, we will be able to take those questions. For those that are joining us on site, we have our team members available to take your questions, and we will feed those questions up to the panelists so that they will be able to answer your question at the very end. I want to say a big thank you to Baker Ripley, for supporting our program today. Baker Ripley is the largest charitable organization in Texas, and it hosts a network of over 70 service sites that help more than 500,000 people every year. Baker Ripley fulfills its mission to bring resources, education, and connection by working with neighbors side to side. When underserved neighbors are strengthened, the quality of life is raised for everyone, not just the community, but the entire region. Baker Ripley is leading the way for building healthy neighborhoods across the country. In the past year, 3 different research groups have published books studying their work, one which is called Every American City. The Brookings Institute researchers wrote, "We learn from the way Baker Ripley is embracing Houston's future and weaving it into its history." So today we have an in-person outreach program happening live at Baker Ripley Community Center in Gulfton, Sharptowns area here in Houston, Texas. And I want to say thank you to Ms. Rocio Wheat, Tyler Agra, Jelixa Moreno, and Sarah Lama McCain for helping us to, all the logistics, assisting us in setting today's program and making it a success. So we are really grateful, and we say thank you to Baker Ripley's team. Additionally, today's program would not have been successful without our sponsors. Again, we have Baker Ripley, we have the Center for Biomedical and Minority Health Research Community Engagement Corps. A big thank you to Bread of Life, Humana for sponsoring our lunch for today, Exotic Pop, bringing in water and drinks for people that are attending in person, Village MD, Village Medical, providing medical, support, blood pressure screening, and different types of activities going on, as well as Golden Outlook, providing support for us, bringing us fruit tray this morning to be able to engage people that are attending on site. So a big thank you to all our sponsors for today's outreach program. We also want to say a big thank you to all our vendors. Today's program would not have been successful without your support. Blue Cross Blue Shield, Community Health Choice, Link Nonprofits, Zodo Design, Next Gen Preventive Care, Rocco Boutique, Molina Healthcare, again, the Center for Biomedical and Minority Health Research, Research, CSU Advanced Health Equity Program, CSU Aggressive Prostate Cancer Program, Hail Mary Care Outreach, as well as She Faso Cold Pressed Oil. So for those that are attending in person, please don't rush away. After today's webinar, stay on to continue to engage with all our vendors and partake of the great things that they have to share with the community. At this point, I want to say a big thank you to the baddies of the Breast of Us. A cancer diagnosis changes everything. As a woman of color, where do you go or where do you turn to in the midst of the fight for your life? You search online for stories and images of women who have gone through treatments and look like you, but you find little to nothing. Maybe you scroll down through your timeline on social media, hoping to see a glimmer of hope in the face of other fighters and survivors, but you still yearn for something more. That's where For the Breast of Us comes in. The mission of this group is to empower women of color affected by breast cancer to make the rest of their lives the best of their lives through education, advocacy, and community. So we're very grateful that today we have 3 awesome baddies from the Breast of Us that are joining us. And I want to say a big thank you to Miss Cynthia Johnson, who is the Director of Administration and Assessment at CSU College of Pharmacy, and also a baddie ambassador for making this connection happen and helping us to, coordinate the presence of these awesome panelists that will be sharing with us over the next few minutes. Now I'm going to introduce to us, before I do the introduction of our panelists, again, like I said earlier, we are funded by CPRIT, so we are very keen to hear back from all our participants, in-person and online attendees. So please complete the survey. We have it in English as well as in Spanish. All these links will be posted for online attendees in a little bit so that way we can hear back from you. And please continue to stay engaged with us. Again, welcome everybody for joining us for today's program. At this point, I will introduce our panelists, esteemed panelists for today's program. The first panelist we have is Michelle Anderson Benjamin, who is a wife and a mother of 2 from New York. At the age of 36, Michelle was diagnosed with stage 1 triple negative breast cancer in 2020. And unfortunately, in 2022, her cancer returned and it is now metastatic. She was first inspired to turn her pain into purpose when she was first diagnosed, but in learning that every day given is an opportunity to be legendary. She started the Fearless Warrior Project LLC as an opportunity to be the voice of the voiceless and bring awareness and demand change to health disparity within the cancer community. She also became a certified mental health coach and advocate because she noticed the lack of attention to cancer patients' mental and emotional health. Our mission is to help and train individuals the importance of self-care, emotional balance, and healing from past and current traumas. It is such a pleasure to have you join us today, Michelle. We are very happy to have you with us. Thank you. Okay, then I will go ahead and introduce our second panelist for this session, Aisha Morgan. Aisha Morgan is an educator and mother of a 2-year-old daughter. She enjoys traveling and exploring new places in her area. In March 2022, very recent, within a year ago, Aisha was diagnosed with stage 1 invasive ductal carcinoma HER2 positive breast cancer on the right breast. In April 2022, she started 6 rounds of chemotherapy and decided to get a double mastectomy with reconstruction. Aisha has completed active treatment, but is still on maintenance medication until April 2023. She found community after joining the Breast Cancer Baddies and for the Breast of Us on Facebook. Aisha vlogged her journey on YouTube to help other women see the ups and downs of living with breast cancer and undergoing treatment. Aisha, we are so blessed to have you join us this afternoon. We appreciate you. Then I would introduce our third speaker for today, who is also going to moderate the panel discussion. April Finley is a 6-year triple negative BRCA1 positive breast cancer survivor who was diagnosed at the age of 35. That is a young age of 35. She is a single Southern belle who advocates for women of color in the fight against breast cancer as a baddie ambassador for the Breast of Us, the first online community dedicated to women of color affected by a breast cancer diagnosis. April is also an advocate for children and has served as a school counselor for 17 years. She is a proud member of Delta Sigma Theta Sorority, Inc., and the mother of an adorable miniature pincher called Georgia Grace, also known as Gigi. Thank you, April, for joining us. Ladies, it is my pleasure to have you all on the line today. And I will turn my camera off and turn it over to April, Michelle, and Aisha for an incredible discussion this morning. Thank you very much.
Thank you. Good morning, everybody, or good afternoon. How is everyone doing today? We are so glad that you have taken the time to join us to be with us for this important and necessary conversation. Uh-oh, I'm seeing a little feedback. Can y'all hear me okay?
Yep, we can hear you.
Okay,
a little bit.
All right. Okay, I saw that I was twitching.
Yeah.
That was interesting for a minute.
we about to go in the Matrix.
Right. All right, so well, ladies, let's get this conversation started on this glorious Saturday in February. I don't know about where you're over in Texas or up in New York, but here in South Carolina, yesterday it was 80 degrees and today it is freezing cold. So I don't know if you're dealing with the weather bipolarness in your areas, but I hope that it's still a beautiful day in your area, your space. So for our viewers, if you have any questions about anything, please be sure to put them in our chat. We will have a Q&A discussion towards the end. I would like for us to kind of get started. As you've already heard our introductions, I'm going to throw out a couple of questions and we're just going to have a casual Saturday conversation, all right?
Okay.
All right, so sounds good. So to get us started, first question I would like to ask would be to Michelle. So I will ask, I need you to pick one.
Okay.
Okay. So the question is Jay-Z or Method Man, and tell us why.
Girl. So I would pick Method Man.
Okay.
The reason why is that I've been to a lot of Jay-Z's concerts, and yes, I love his music, but Method Man just has a swag about himself.
I agree.
Just, as you get older and you see how people season and they season just right, one of those things that, like, I can listen to Jay-Z anytime on Tidal and iTunes. I'm good.
Right.
But I want to feel the concert. And
right.
Method Man, he just really has a swag about himself. It's kind of like with LL Cool J when you watch NCIS. You understand? It's like it's a different type of a grown man going on right there.
Right. I agree. Okay, sis, what is your perspective?
Mine?
Aisha?
I mean, I would pick Method Man too. Again, I like Jay-Z's music, but I also have been to concerts of his and it's very dry. The concerts that I've seen, I'm from New Jersey, by the way, so I'm like,
okay,
that's me and Michelle are there. But and the one that I saw with Method Man, he was with Wu-Tang, so that in itself is like undescribable, undeniable greatness.
Absolutely. And I'm sure for our viewers, you're probably wondering, what does this have to do with breast cancer? Well, I'm glad that you asked, and I will tell you. So one of the many things that we face as survivor thrivers is for those who are a part of our lives who have not been diagnosed with breast cancer, really don't know what type of conversations they can have with us. So I wanted to give you an example of a conversation that you can have. Treat us like you would treat us before the diagnosis. We still live, we still breathe, we still love to have conversations outside of our diagnosis. And there are times, to be quite honest, where we get tired of talking about it. We're here today to talk about it, but I just wanted to kind of share with you, we're still people, we're still human, we still want to go out, enjoy life. And we will talk about how we have chosen to live life more fully after a diagnosis, as opposed to allowing the disease to define how we live our lives. So to answer my own question, I would definitely go with Method Man for all of the same reasons that you ladies have shared. But I watched an interview with him recently where he shared that he's married and he's been married for a number of years. And he shared that he keeps his wife out of the public eye because he said, that is my personal life. And he doesn't want anything to come in between he and his wife, his marriage and his professional career. So I was like, oh, I love that. A man who's gone taking care and protecting his wife. I just thought that was, I mean, more reason to love him and his getting not older, but just more seasoned self. Oh gosh, he's so handsome. So,
and also to share with you about his wife. I think his wife is a breast cancer survivor.
That's a survivor.
Yeah. So the fact that he respects that and in a way protects it like a real king should.
Absolutely.
Highlight.
Absolutely. I forgot about that piece, but yes, absolutely. Absolutely. Okay, ladies, well, let's get to the reason why we're here, and this is to talk about breast cancer and talk about our healthcare disparities. So I will ask that, Aisha, tell us a little bit about your story. I was on an interview recently with a young lady who was asking about what was my diagnosis experience. So would you like to share that with us a little bit so we can kind of talk about?
Yeah. So my doctor, who is African-American, my gynecologist, she was the one who initially found a lump in my breast. Previous to me going to the doctor, I had stopped breastfeeding maybe a couple of months prior with my first child. Really did not understand the after effects of breastfeeding. So blood and like liquid was coming out of my breast. And I thought that was just the aftermath of stopping breastfeeding. You know, maybe it was like my duct was clogged or something. And then there was like a large lump in my right breast. Again, I'm thinking that it was from me stopping breastfeeding. So when I went to the doctor, my gynecologist felt the lump. She asked me some questions and pretty much said, like, anytime blood is coming out of your nipple, that is not a good sign. Like, you always want to get it checked. It does not matter if you're breastfeeding or not. And so I went through a series of tests, biopsies, a second mammogram. I got a bunch of different tests. I don't even remember all the stuff that I had. And my doctor was on vacation, and one of her doctors called me, and she gave me this laundry list of very technical words and told me that I was going to be fine, that there was going to be a treatment plan created. And I stopped her and I said, wait, are you saying that I have cancer? And she's like, oh yeah, you have breast cancer. Like very nonchalant, not with any type of concern. She was not African-American. And, you know, was just very, very much so, like her bedside manner was not very good. And so the next day, my doctor who was on vacation actually called me. And she said, you know, I wanted to be the one to tell you, but I know that my associate called you first. And so I did tell her exactly my experience, and she apologized. And she said, you know, she's a breast cancer survivor. I think maybe 4 or 5 months before she diagnosed me, she completed her treatment. Mm-hmm. And so she said, in the past, that's probably how she would have also delivered the news to someone. Mm-hmm. But because she had went through cancer diagnosis and treatment, she said that you have a different perspective of how you need to talk to people about things like this, which is why I wanted to call you and tell you exactly what happened, what did we find, the results of all of your tests, and then going forward, what you're going to need to do. And the fact that, you know, she took time out of her vacation to call me and tell me exactly what was happening with me, it meant a lot to me. And I'm not sure that she would have done that if she didn't just go through cancer treatment.
Wow. That experience, first, you were very blessed to have a doctor who has been on the journey as well.
Yeah.
So that is definitely not the case for many of us. So right. I'm very thankful that you have her. But I do apologize that you had the experience of her associate being so nonchalant about sharing your diagnosis. And I think that might be, and it's unexcusable, period.
Right.
But I do think that when you're working in this world, similar to counseling, you hear about hard things, difficult things, and you become numb to it.
Yeah.
And I think that is an area that doctors have to be more focused on is their delivery, as well as making sure that they're getting the help that they need as well, working in these hard spaces, because you can't lose that concern or the show of empathy towards your patients who are newly diagnosed.
Right.
Michelle, how about you? I know that you have unfortunately been in the position twice to be told about a cancer diagnosis. I'll allow you to pick which one that you would like to share with us.
I guess I can share. I'll share the most recent. So I'm fortunate enough to work in healthcare. So I am a healthcare administrator for a cancer hospital in New York City. And from the very beginning, my medical team was very hands-on. I don't know if it's because of the fact that I just, my aggressiveness of my care. Like, I came in with the attitude, like, we not playing games here. This is my life. I'm fighting for my life, and y'all gonna treat me as you would treat your own. So certain questions that I would ask my doctor when, you see, well, I also had blood dripping from my breasts. So I experienced that as well, Aisha. I didn't have, they thought it was from breastfeeding, but my daughter was 3. I stopped breastfeeding a long time ago. And I didn't have a lump. I had wound up having many microcells in my breast, in my milk dud. But I always started a conversation with any medical doctor. Would you give me this treatment, or would you refer this doctor if I was your wife, or if I was your family member? Because I need them to understand that I am just like you. Once you take this white coat off and you walk out this building, you just like me. We're not the same shade, but we're still people. So a lot of times, doctors will refer you to other doctors, and you don't really have a choice doing your own research. So I would always come to the table if I knew I needed a breast surgeon. I had 3 breast surgeons in my notebook that I was like, all right, so out of these 3, these are the pros and the cons that I found out. What are you, it was a negotiation, because at the end of the day, this is my life. But when I was told of a reoccurrence, how it was found, it wasn't because I had, I was having anxiety attacks, and they were very abnormal. I would have to go to the emergency room because I would be home and get really tired, feel like I'm about to pass out, feel like 911 needed to be called, because my blood pressure would go low, my heart palpitations will go high, and oftentimes I would be home by myself. And they saw my lymph nodes lit up from an X-ray, and then I had to get a CAT scan and a PET scan, and they did biopsies. And now with my chart, my chart can release your results before your doctor gets a chance to give you a call. And I already, told my doctor, I don't want no bad news. Like, I'm already going through stressful moments. If there's something bad, call my husband. He can explain it to me in a way that you telling me it's not going to work. And I saw on the report before my doctor called that, my nodule near my chest wall came back positive, and the words metastatic was shown on the report. So, and it just so happened, an hour later, my husband showed up from work earlier than expected, with a face like he couldn't even look me in my face. So he was like, oh, we need to talk. And I'm like, what's up? And he's like, your doctor. I was like, oh yeah, my doctor called. I know I got stage 4. And he was like, already? And I'm like, I saw the report, but I shut it down. But I encourage people. I've experienced both sides of the discrimination, right? And I encourage people. And one of the things I always tell people, especially in health, when you're going through trauma, even you're going through a healthcare like cancer, right? And when you're scared, even if you don't have the voice to fight for yourself, if you're in a position where you feel like you're being mistreated, ask for a patient rep, period. Ask for the healthcare director, period. Like, you don't even have to go back and forth with the person. You don't have to feel like you have to defend yourself in that moment. Just ask for a patient rep. And I say that to say, because unfortunately in healthcare, everyone is not going to treat you like you're a person. And unfortunately, women of communities of color get the short end of the stick. I've been in positions where I've had people talk to me crazy and didn't know that I worked at the hospital, that they would talk, that I could make a phone call or send a text message and their whole world would be shut down. And it's had to happen. I've had situations where I'll be in the waiting room and the front desk rep was disrespectful, and I just look at her and I'll be in the waiting, and I'll send a text, and a slew of supervisors will run downstairs and go and speak to her and go, oh, you don't know she works here? Or you don't know she knows people here? And then that person got sent home for the day. But it shouldn't have to be that way.
Right.
And I made it a point of using my voice, especially at the, where I'm at, to speak to the board, the head of the hospital, let them know this is unacceptable, because it shouldn't be that I know people that this is why there's a change, right? There shouldn't be that I can know if I feel some type of way, I know who to call and y'all will make it right. That's not right, because what about the person that comes behind me?
Right.
You know, even like I tell people all the time, as a mom, my daughter matters, right? So if my daughter ever has to come through this experience and you guys ain't got it together by then, it's going to be a problem. It's going to be a serious problem. So I went through those experiences, and I went through those times where, sorry, my doorbell is ringing and my daughter's, she holds the bell for 10 seconds. But it's about, you know, advocating for yourself, and, you know, and it hurts. It hurts when you're going through it and you feel like you're treated less than. Like, and you're already going through it. You're already going through the fact you have cancer, right? And death, automatically death. I'm going to die, right? And then you treat it like you're not even worth fighting. And now you have to kind of pick up the pieces, because a lot of times we are the individuals in our family that hold the strength. So now we got to look at ways to build up the strength within ourselves, because our family members are looking at us as guidance. Right.
I want to comment on something that you said a moment ago, is that if you don't feel comfortable enough, and this is for the audience, I want you to hone in on this. If you don't feel comfortable enough to receive the information from the doctor, to ask for, say that one more time, a patient advocate?
Patient rep. So every institution, every doctor's office has a patient rep department. That is someone that is the rep. It's supposed to be an advocate for you. They are there to be there for you and to be your voice. They know the rules and regulations of the hospital. They know the right and wrongs. And if you feel that you are mistreated, those patient reps can also put in what is called risk reports. That can be written up against any member of the hospital, and it goes in their file.
Wow.
Yeah, and if a particular person has multiple risk reports, that can be part of disciplinary action against them.
This is interesting, because I think about the many people who receive that information, just even via phone call. You would think that a cancer diagnosis would warrant an appointment for a patient to come in to be told this information face to face. And a lot of times people go in for these appointments alone, and you're there and you're receiving this information. Today, I am years old finding out about having a patient representative. I've never heard that ever.
Same.
So I appreciate you sharing this information with us and with our audience, because this is information. This is what healthcare disparity looks like. If we don't share our stories and we don't share our knowledge, we can't help the person who's next, because there's going to be another woman, there's going to be another man, there's going to be someone else of color to be diagnosed. And this is the kind of information that we need to share. So Michelle, I greatly appreciate you for sharing that, as well as your story. I want to ask you both, from the time of your diagnosis to the time of your first treatment, how long did you have to wait?
I did not wait very long. So let me preface this again. My doctor had breast cancer. I went to all of her doctors. So she referred me to her doctors. So she was in constant communication with my oncologist, with my breast doctor. The only one that she did not have was my plastic surgeon, because her plastic surgeon was not in my insurance network. So when originally they gave me a treatment plan, and I went and got did I get an MRI? What's the one where you're like enclosed in that thing? Is that it?
MRI.
Okay, I went and got an MRI because they were not sure my stage originally, because the mass that you could feel on the outside was not the cancer. It was calcium deposits. And underneath the calcium deposits was where the cancer was. So they, when I got my MRI, they were able to see my stage. And then from there, they literally like back to back called me. My breast doctor called me. My actual doctor called me while I was on my way to my oncologist for another appointment. So it was pretty fast. I mean, they told me, like, you need to come in to get your port put in tomorrow so that you can start your treatment next week. my chemo treatment. So again, I do think that the fact that my doctor, these were her doctors, did make a difference for me.
Okay. That's awesome. Michelle, how about you?
So with me, my treatment plan was a little backwards because I was my breast was leaking blood nonstop. Like I literally had to wear a pad in my bra and change it throughout the day because it would fill up. I had a mastectomy first of my right breast. But
was this your first diagnosis or second? I'm sorry.
My first.
First, okay, gotcha.
So like I went to the hospital, for example, I went to the hospital Monday, which I went to like a local ER, had an ultrasound. They saw something that didn't look right. They referred me to get a mammogram. I called my hospital. I got in that same week, that Wednesday. From Wednesday to Friday, I had ultrasound, mammogram, 3 biopsies, and an MRI, and had a pre-diagnosis by that Monday. Wow. By that Monday, I was meeting with the breast surgeon, and from his feel of things, he was already saying it was like stage 2 and 3 because I had enlarged lymph nodes. But they can't really give a real diagnosis until they actually have the breast, the actual tissue. So because of the leaking of the blood, we wanted to stop that first before any treatment. So I had my mastectomy first. I had my mastectomy within 30 days. And that's because I asked him for 30 days. It wasn't a rush, but I needed 30 days to get my affairs in order. And why my affairs were my family, I literally got my insurance, all my insurance policies, paperwork, put a plan in place, spoke to family members, got my village together, made sure that my kids, at the time they were doing remote learning. So we were going through a pandemic. So this is like another added thing on top of what we're already dealing with. My son's in middle school, my daughter's in daycare. Mom just can't be out of it and not have a safety net in place. So I gave myself 30 days to prepare everything. And I always tell people, it's like, you have to prepare the chessboard so that you could play the game. So once I had everything in place, I could just focus on Michelle and knew that everything else was going to be taken care of. So I had tutors for my son to help him with his homework. I had, he was going through high school admissions. He had a singing coach because he was in a performing arts. He wants to go to performing arts high school. I had, help from my husband. I had a cleaning lady, all of these things in place. And then unfortunately, I had issues with the tissue expander, which is a device they put in your breast before they do any reconstruction to keep the muscle and the skin separate, to make sure that there's a space for them to either put an implant or whatever reconstruction style decision you make. My body rejected the tissue expander 3 times.
Oh, wow.
So if anyone ever had a tissue expander, once it get infected, it has to be taken out and either replaced or removed. So that delayed treatment for 3 months. Okay. Because I was going back and forth with that. And then once I started chemotherapy, went well. I had side effects, but not aggressively. My main complications were from reconstruction. Okay. Reconstruction caused me to have 9 surgeries.
Okay. And I want to come back to, for us to talk a little bit more in depth about reconstruction and reconstruction options. And thank you for sharing, Michelle. I wanted to share my story a little bit because my story differs a good bit from both of yours. Both of your stories are positive. It sounds like your doctors were on top of things, whether it was because of established relationships or because of your experience in the workforce. For myself, I was diagnosed, I will start that I began having some very intense pain in my breast. So much so to the point that before reaching out to my doctor, I was in tears all night. So I knew I had a family history of breast cancer. I had been very vocal about this with my gynecologist. Although I was 35 years old, I knew that there was a possibility that it could happen to me. So I knew that because I had very large breasts, I requested an ultrasound. So I called my doctor's office. I asked her to write me an order to have an ultrasound done. And she called me back. Her nurse called me back and said, no, she wants you to come in and have you examined. So I went in and I was examined by her. My gynecologist was an African-American female, older female, and she examined me and she said, well, I don't feel anything. So I actually had to place her fingers on the spot. And she said, I don't think this is anything. I think it's a cyst. And I said, well, you can't say that with my family history. She said, yeah, you're just too young. I just, in my medical opinion, I don't think that's what it is. And I said to her, well, I truly appreciate your medical opinion. However, I'm not leaving this office without it. And a lot of times doctors, healthcare providers will try to talk us out of something because, oh, your insurance doesn't cover it. Let me explain something to you. Our lives are more than what our insurance will cover, okay? And one of my biggest qualms as a patient advocate is, well, why is it not covered? But that's a whole other story. We'll get on that soapbox later. So I get the ultrasound. I wasn't able to get in for 2 weeks to have the ultrasound done. This is the beginning of the school year. I'm a school counselor. Actually, at that time, I was over my department. So I was overseeing 6 other people, as well as getting kids enrolled in school, over close to 800 kids. So you got the stress of that, having to take off from work, go get these ultrasounds. So I went and had the ultrasound, and then they followed up the same visit with a mammogram. And so as I was getting dressed, I was sitting there waiting, and the doctor came in that reads the results, and I could tell by the look on his face that it was cancer. But I had to come back in and they wanted me to come back in and have a biopsy, which was a week later, which I did. And I got a phone call that it was cancer. And that was on August the 31st of 2016. And then I had appointments that were scheduled to see the medical oncologist, to see the breast surgeon. I received a phone call from the nurse navigator who told me she would be sending me a book of all of the different types of breast cancer, different type of chemotherapy drugs, different reconstruction options, whole nine. So then it became a hurry up and waiting game. I literally did not receive treatment for 2 months, almost 3. And I didn't start treatment until I had become frustrated with my appointment with the plastic surgeon of all people. I would see the medical oncologist who really wanted to go ahead and start chemotherapy, but the breast surgeon wanted to do surgery first. Whenever I asked questions, it was just very nonchalant of, oh, well, it's just a little cancer. It's not a big deal. It's just a little tumor. Literally, these things were said to me. I even didn't realize that the breast surgeon and the plastic surgeon were 2 different people. So I asked a question in what I thought was my final appointment before surgery. You know, well, you haven't even talked to me about reconstruction options. Like, well, you didn't say anything about it. You didn't say that that's what you wanted. I'm sorry. I'm new to this process. I didn't know that was something I should even ask you. Yes, I had read this book, but I didn't know. I didn't have any friends who had been diagnosed with breast cancer. Although I had a family history, everybody in my family were older. They were in their 40s or 50s when they were diagnosed. They had already had children. I was single, didn't have any kids. So anyway, off track. So I go to the plastic surgeon appointment, and I had already read up that I wanted a DIEP flap because I did not want anything foreign in my body. I wanted to use my own tissue fat to reconstruct my chest. And I walk in, and there are several examples of implants, silicone, saline. He goes through this whole presentation about the different types, and then he says, all right, well, which one would you like? Do you have any questions? I said, yeah, you haven't spoken to me about any of the other options that are out there for reconstruction. And he said, oh, well, is there something else that you were wanting that I haven't discussed today? I said, yeah, I want a DIEP flap. And at the time, I didn't know or understand that the only surgeons who could perform that type of reconstruction are those who went through specified training for microsurgeries. He says to me, oh, well, you won't be happy with that because you won't ever be the size that you are now. I won't be able to get you to that size with a DIEP flap. And plus, you're too heavy to have that procedure done. Of all of my appointments, I felt so hurt and felt ashamed and I don't even know why, but I did. And that was the appointment that sparked the fire for me to get a second opinion. And I went to my second opinion. It was a consultation appointment. It was a 3-day appointment where I met with every single person who possibly would give me care. And it was through a private hospital that offers total care, everything under one roof. The appointment started on Tuesday. We finished on Thursday. I had my port surgery on Friday. I started chemotherapy on Saturday. And we're at this point, I was almost 3 months after having a diagnosis. So I was looking at something either on social media or I was watching something on the news that was saying that it is common for women of color to not start treatment until after 2 months of a diagnosis. That is insane. That is insane, because that could be the difference of a diagnosis moving from stage 0 to 2 or 2 to 4. And just the disregard for our lives is just, it's unimaginable. So just think about our mothers or our grandmothers who were taught and told, you don't question the doctor tells you, you trust your doctor and you do what they say. Imagine how different that could have been from day one with my gynecologist, who was also a woman of color.
Yeah, I hate that you had to go through that, April.
I think you're on. Are you on mute? Uh-oh, hold on for a second. Hold on. These died. Hold on, y'all. Background music.
I'm so sorry you had to go through that too, April. I'm over here like,
okay.
Wow. Because honestly, and the thing is,
can y'all hear me?
Yeah, we can hear you.
I can't hear y'all. Hold on. Let me see if I can fix this really quick. Go ahead and continue with the conversation. I don't want to stop that for our viewing audience.
That is one of the fears that especially communities of color, even Spanish speaking individuals, that there's a language barrier and they're treated as if, people talk over them and don't have a translator in place. Like every hospital has a translation, interpreter program that they can provide services in any language to patients. And that's what patients have to understand. Like even at my facility, I can do a telehealth appointment with a patient with an interpreter on the telehealth appointment, and the interpreter can explain everything to them. These are services that they are entitled to. And the more you hear about the discrepancies that happen. I was fortunate enough to have my husband with me, and although he is very quiet to some people, he's an observer. And he's a quick to shut a person down. Like I'm a straight face, I'm gonna shut you down. He's more of like, he sits back and fills the room out. And if he don't feel something is right, he stands up and shuts it down. Mm-hmm. But the fact of the matter is, in a vulnerable moment, we shouldn't have to feel that way. Mm-hmm. We should feel comfort. And, I hear this a lot, even, with speaking with women that come to me about being diagnosed, how clinical trials is never part of their conversation. Fertility options is never brought up in their conversation. How different treatment options is never discussed in their conversation at their appointments. And oftentimes, when they do bring these things up, doctors look at them and like, oh, you know about that? Yes, I know about that. The fact that any woman that's diagnosed before the age of 40 legally is entitled to genetic testing, especially if they don't have family history. So once you're diagnosed, so I had I didn't even have to ask for genetic testing. When I was told, you have cancer and this is what it looks like, they had the genetic counselor already waiting for me in the consult room the next door.
Well, sis, I think that was because you had already made it known who you were before that.
Yeah, but even so, my doctor explained to me, he goes, no, any woman before the age of 40, especially that is diagnosed with breast cancer, they encourage genetic testing, especially if you do not have a family history of breast cancer in your family. And I'm the first person in my family with breast cancer. My family has a heavy prostate cancer on the male side. And then that's another thing. There's research studies that show that breast cancer and prostate cancer are brother and sister. And this is another conversation that we need to have at the dinner table. I tell people all the time, families of culture and color have to start talking and stop gossiping.
Absolutely.
We gossip very easily, but we don't talk about the things that's going on in our family health-wise. We don't hear about grandma had cancer before until grandma dies. Absolutely. Or Uncle Billy had this, and until he died. Or until he's on his deathbed. We need to have these conversations. Yeah. Because we are lacking that extra, ammunition to have conversations with our doctors. Because in reality, just by you having a family history of anything, you cannot be denied.
Absolutely.
And doctors cannot continue to play the game that insurance won't pay. Insurance goes by what the doctor puts on that paper and the coding that the doctor puts on that paper. If the doctor puts that you have family history of A, B, and C, and he recommends or she recommends that you are at high risk for that, the insurance will pay.
Yes. Yeah. And I have a family history of colon cancer. And so my colonoscopy was covered by my insurance, but otherwise, like he told me it wouldn't have been. But to go along with what you said, when I told my family about my breast cancer, they literally start telling me all these people in our family who had breast cancer. And Absolutely. I had no idea. And I'm like, what? And then the crazy thing was, maybe like 2 or 3 years ago, my mom told us that she had pre-breast cancer cells and was on like medication for 5 years. But prior to my sister having cysts, we never knew that my mom had pre-cancer cells and was on these pills for 5 years to make sure that it didn't turn into cancer. And, you know, I mean, I expressed to her my disappointment because I should have been getting mammograms earlier, knowing that she had pre-cancer cells when she was 35. So definitely agree with that. Having these open conversations about things, because we need to tell our doctors our family history, but if we don't know it, we can't give them all the information.
Well, let's also hit, my story is similar to yours. Although I knew that my grandmother had breast cancer twice, my grandmother recently passed on Christmas morning. She was 101 years old. And I am so although I am sad that my granny has gone on to be to the other side, to be our ancestor, I am very thankful that I had her a part of my life. But it wasn't until I was a teenager or almost a grown woman that I found that my grandmother had breast cancer. My grandmother all my life, in my opinion, had breast because I always saw her with humps. But come to find out, Granny was flat. And Granny wore the bras that had the padding, the old school bras. And I didn't know really about the family history until my aunt shared her genetics report with all of the first generation granddaughters. And even when she gave it to me, I didn't know what it was. It was in an envelope. She said, hey, I'm BRCA1 positive. Here's a copy of this for you to take to your doctor for them to explain it. I was a young woman. The only time I went to the doctor was once a year for, you know, my annual exam. I didn't have a reason to talk about that in my mind. But then when I was diagnosed, the elephant in the room is in communities of color, we don't talk about what? We don't talk about money. We don't talk about family business. And in family business, it includes what? Our healthcare, our health information. And the reason why is because in communities of color, we have been mistreated medically for years and years. So the lack of trust with the medical profession and our health is still very prevalent in our communities. So it wasn't until I was diagnosed where I was even asked by my family, are you sure you want to tell people about this? Absolutely. Why would I not? I don't have anything to be ashamed of. That my family started sharing. I had a cousin who's had an elective surgery to have her breast removed because she was because of her genetic test results. Had no idea. I had cousins who had been getting tested since they were in their early 30s. Had no idea. And because of my diagnosis, my grandmother started to tell her story of what she experienced when she was diagnosed with breast cancer, as well as my aunt. I knew my grandfather had prostate cancer after doing some research. That's when I found that, like you said, prostate and breast are brother and sister cancers. I also was later diagnosed with large B-cell lymphoma, which was found on my ovary that I had to have due to being BRCA1 positive. I had to have a total hysterectomy. That is, although they say that there's no connection, it has to be a connection, and it just hasn't been found yet. Mm-hmm. But I think that we have definitely shared some jewels today for our viewing, those who have joined us for this panel discussion, that we have to advocate for ourselves. We need to, when we're getting information, we should request in-person appointments and ask for a patient representative to be present with us, as well as to take the time to make sure that we're having the questions that we need answered, and not allowing anyone to treat us as a number. So I just want to thank you, ladies. We do have some questions that have popped up in the chat, and I want to make sure that we have enough time to answer those questions.
Absolutely. Oh my goodness. It has been an incredible discussion. This past hour, I am here sitting and saying, wow, I mean, you guys are dropping in and nailing it on the head, literally. I'm so grateful, the audience in person and the audience online, sending in, appreciation for your transparency, your openness to discuss things like you guys said, things that are typically not talked about, but they come back and bite us, right? You don't talk about the prostate cancer history, breast cancer history, the paddings and everything, and it comes around and bites us. So I think this is a clearing call as we are making decisions, coming together, celebrating Black History Month, to say we don't gossip anymore at the dinner table. Let us talk. Let us have a conversation. Let us have a discussion. Let us talk about our health and how we can own in and advocate for ourselves. So thank you very much. Yes, we do have a couple of questions in the chat box as well as in-person questions, but I would like to start with this one. I'm looking at the time as well. There is a question here that says, what is the best way to be a supportive friend, relative, or co-owner for someone newly diagnosed with breast cancer?
I think the best way to be a supporter is just to allow that person to have their moment. I always tell people, especially being a breast cancer warrior myself, and I hear stories about close friends being newly diagnosed. And I have to remember that although I know a lot, right, I have to allow them to process their own diagnosis. And I have to allow them to be open enough to ask me questions. I can't be quick to throw a bunch on them. It's their process. So even from a caregiver's perspective, the best thing is just to be there and not, oftentimes people say they don't want to tell or want to share their story because they feel like their story becomes that other person's moment. And it's like you then now consoling that person and not really dealing with you. So the best thing is just to be there. If you know the person well, try to do things without having to ask them what they need, and just, sometimes even just saying, well, when's your next doctor's appointment? I'll go with you. Instead of saying, well, would you like me to? Or, just saying like, when's your next doctor's appointment? I'll go with you. Absolutely. Or, if they, come across and say, I'm uncomfortable with having that conversation with my doctor. Okay, I'll help you type up the questions and we can email the doctor instead.
Right.
Things like that, listening to what they're saying and then seeing how you can help them resolve that.
Right. Absolutely. That's very helpful. Thank you very much for sharing. I will go over to one of the questions in the chat box, and he says, how can more breast cancer awareness groups, like you guys, the Baddies of Us in Texas Southern University, and so many other groups collaborate together to reach more African-American women? And I would say, a moment of vulnerability for me as the, director for this program, when we're planning these events, I was telling my team, like, hey, how do we really get to the African-American population? How do we really attract attendance and interest? So the question in the chat box is very timely to say, in your experience and the things that you've seen, how can we collaborate to reach more African-American women? And I mean, we don't want this to be the best kept secret, right? We need to get it out there and get the word to where it needs to be. So feel free to share a few nuggets about that.
I'll answer that question, and I'll try to be as brief as I can. I think what's important is that we have to if we're trying to share information with a specific population, we have to go where those populations are. So for the Breast of Us, we are on all social media platforms. You can find us on Instagram, Facebook, Twitter. We have a private Facebook group for women of color only who have been affected by a diagnosis, and we share our information there. There are other organizations who do local meetups in person. Because of COVID, a lot of that has ended, and hopefully we'll be getting back to that soon. But I think we're going to have to start with a grassroots effort of, when you have the information, share it. Be confident enough to share it, even whether it affects you or not. Putting flyers in our beauty salons, sending information through our churches, or posting things in the stores that we shop in, or when we're having panel discussions such as these. Encourage young women from our sororities and young men from our fraternities. Hey, this is something that you need to be a part of, or we would like for you to join in on the conversation. I think that's the only way that we'll be able to connect organizations and working together. And we also have to think about this, that we have to operate from the mindset of working together and not against each other, because we're all working towards the same purpose, right? And that's to have better health equality as well as having better quality of life. We may not be able to, none of us did anything to get cancer. Nobody, you know, went out and did something terrible and oh my God, this is your punishment. No, we can't control that, but we can control the quality of life that we live after the diagnosis. So making sure, as we did in the beginning of the panel discussion, I asked a question about Method Man and Jay-Z, because something as simple as that, which is very important, can open conversations to other things, because then we started talking about Method Man's wife being possibly being a breast cancer survivor, thriver. So, you know, that's the only way that we're going to be able to get more information out there, is to be aware of the spaces that we're in and just to share and to talk. And going back to what my sis said, let's have conversation. Let's not gossip about things that are not important.
Yeah. And I just want to add to that. I'm a firm believer that collaborations trump competition. If you look on any of our For the Breast of Us social media handles, we promote other organizations. We collaborate with other organizations. This is not just like, oh, this is us and this is what we do. No, we are firm believers that, you know, we are a community, and the bigger we are, the bigger our impact is. And that's one of the main things I honestly can say. Like for me, when I first was diagnosed, For the Breast of Us was the only organization that I could see representation that looked like me. And in that process, they also open the doors for other organizations that they know of, that, you know, if you want to become an advocate, well, Living Beyond Breast Cancer has a advocacy program, or Tiger Lily Foundation have an advocacy program. It's not an invite only type of organization. You know, we are open and willing to work with and want to work with everyone. And a lot of times within this community, everyone has that same mindset. You know, everyone, you know, we had our sneaker gala last year in Texas. We had Sisters Network there. We had Touch BBC. We had the Breasties. We had other organizations that were there to celebrate with us, because the reality of it is much bigger than just, you know, what people don't realize, the numbers don't lie. You know, we are the most affected in this journey, and not just breast cancer. In any cancer category you look at, we are the ones being hit the hardest. We are the ones dying the quickest. And cancer does not see color. So why is that happening?
Absolutely. I mean, absolutely. So definitely, you know, continue to explore, you know, for us as, you know, an agency that is currently funded, and even looking outwards, right? Collaborative impact. That's the only way we can make bigger impact, when we collaborate and reach. And I'm looking at, you know, people posting in the chat box saying, okay, connecting with the churches, and even looking at, you know, political organizations connecting with the churches and making an impact in that manner. So thank you very much. I'm looking at the time. I know we're over time, but there are two other very important questions that I want us to quickly answer. One from the on-site audience. Someone is asking about self-breast exam for a woman that has a bigger breast. So what recommendations would you have, just because, you know, how much can they feel? You know, is that something that they are necessarily comfortable doing? Self-breast exam for a big breast tissue.
Okay. Well, I will, since I'm the big girl here.
No, I was too, girl.
Oh, I'm sorry.
I had an H cup.
I had an H cup. Also, my plus size Betty. I'm sorry. My bad. I was thinking more so about these girls up in here.
But they're not. Mine's been cut off, but I was an H cup. I was an H cup before.
Okay. So just to kind of give a quick demonstration, just going to kind of lower my camera a little bit. You're going to always want to, once a month, just put your arm over your head, and you're just going to want to feel around in a circle. Just feel around in a circle.
Fingers like
with
this.
With your fingers like this, feeling around. And you're going to go underneath that armpit. Make sure you get under there and check. Also, you're going to want to check around your neck too, because there's tissue up there that can be affected as well. And you're just going to keep going around, and then you're going to get to the center with your nipple, feeling around there, pulling on your nipple, and then you'll repeat the process on the other side. And you should do this at least once a month. You can do it standing up in the shower. You can do it laying down. You have to get comfortable with feeling yourself, because that's how I knew that something was wrong with me, because I felt it. I found it. I could tell the difference of, okay, it's hard over here, it's soft over there, because we are the experts on our body, okay? If we live in these bodies 24/7, 7 days a week, 365 days a year, and 366 on a leap year, okay? So there's nothing a doctor can tell us about what's happening in our body that we don't feel and experience, because they don't live in our body, we do. So the only way that we're going to be able to speak knowledgeably about what's happening to us is what? We got to know ourselves.
We need to know ourselves.
Yep. You got to know ourselves. So you've got to feel around, and you've got to check. And just because you have a larger chest doesn't mean you would do anything differently than somebody who has a smaller chest. You're just gonna, it's gonna just take you a little bit longer.
Yep. You might have to lay down a little bit to get all around the whole thing. You might have to do it like a swoop, but it don't take, you know, and I tell people all the time, it's never too early. My 6-year-old daughter checks her breasts, her nipple, her buttons, every night. And I tell people all the time, you should know your body like tying your shoe.
Absolutely.
Yeah. Absolutely. This is incredible. And I want to say thank you again to you ladies and even to the audience. This is a very engaging discussion. And I do apologize. We will not be able to take every single question. Please, for the audience online that are sending us questions, please go ahead and maybe email it to us if you want us to expatiate more on those questions. But I do want to be very respectful and mindful of the time of the panelists, as well as of our in-person attendees, because we have the outreach, you know, program going on. But please, if there are any pressing questions, again, I apologize. All the questions are very important, but I have to stay very mindful about the time. So I would have to transition us off the discussion so that we can, you know, share a few announcements and wrap it up with the webinar. But again, Michelle, April, and Aisha, I mean, you guys have been incredible. Thank you for sharing with us this afternoon your experience, your transparency, and helping us to advocate more, you know, about the things that are important to us. A lot of, you know, snippets and nuggets have been dropped today. And like you said, breast cancer goes hand in hand with prostate cancer. I also happen to have the privilege of leading a prostate cancer initiative at Texas Southern University. Okay. So for those that are on site, feel free to stop by at our table. We have information about prostate cancer. We know all about the breast, right? We're talking about, okay, doing the examination. Men, they don't want to talk about it. Most men don't even know where the prostate is in the body. Like, that is how bad it is. You know, we had a year-long work group discussion, and we had to dedicate 3 months to inform men of where is the prostate. Like, that is even how critical it is to our men. So, you know, to the point that Michelle made, let's make the dinner table a place where we have conversations, not a place where we have gossip. And what exactly are we talking about? Let us talk about our health. Let us talk about things that impact our livelihood to empower us to advocate for ourselves and advocate for our generation. So thank you very much, ladies, for joining us. I will switch over to continue, you know, the slide so that we can get through a couple of announcements that we have, and then we'll be able to close it out from there. Okay.
I would just want to say really quick, Dr. Veronica, if you could get the questions that we were unable to answer, maybe the 3 of us can, you know, come together and do a live chat where we will answer the questions, and we can maybe post it later to this video or add it in addition to, because we weren't able to answer all of the questions at this time.
That is incredible. Wow. You see that? This is dedication. This is commitment to the community. What else can I say, right? Thank you very much. And you know, one of the great things is this session is going to be posted on YouTube, and the live session that you guys will do to discuss this, and you know, we can definitely coordinate, do it offline, and make sure that it's added into that same YouTube feed. So please, all the questions that have been posted and the ones that I received from the in-person attendees, we will get to them. These same ladies would answer, and we would add it in, and it will be all posted on the YouTube feed. Man, April, Michelle, Aisha, what can I say? Dan, thank you, right? Thank you very, very much. So I'm going to make a couple of announcements. I've posted into the chat box the link to our survey. Again, we are funded by CPRITS, the Cancer Prevention Research Institute of Texas, and we do need your feedback on what we are doing. You know, what can we do differently? What else do you want us to talk about, right? I don't decide the topic. I lean in on collaborators and partners to let us know, where do you want us to meet? Do you want us to have in-person sessions like these, online sessions? So please feel free to complete the survey. One of the things that the ladies mentioned earlier was clinical research participation. And I'm glad to inform you that, again, Texas Southern University, we are very blessed. And I have another grant-funded mechanism that is leading the charge about having an open conversation about clinical trial participation. So that grant is under the Community engagement call, and we will be having a conference on April 22nd. It's going to be on a Saturday like this. It's going to be longer from 9:30 to 2:30, but guess what? We have breakfast, we have lunch, and we have snacks. So please show up, engage with us. It's going to be both in person as well as online. So either way, however you're comfortable, engage with us so that we can talk about clinical research participation. What are the barriers? What are the challenges? How do you approach a physician to be able to make an informed decision and become an advocate for yourself, for your health, and for the upcoming generation? So please save the date, and we hope you are able to partner with us and join us in that upcoming event. Again, we are Texas Southern University Breast Cancer Screening and Prevention Center. We have the opportunity to offer no-cost screening diagnostic services to women living in Harris County, Grimes, Matagorda, Walker, and Wharton. We offer patient navigation, barrier reduction services, as well as breast cancer awareness and education. Feel free to stay connected with us. The QR code is there. You can send us a text message. You can send us an email. You can also connect with us directly by phone. And the pictures on this side of the screen is showing some of the great works that we did in October when we had an event on campus, and we were able to engage with elected officials that came and gave us recognitions and proclamations. And I do want to acknowledge the presence of Councilman Edward Pollard. He actually stopped by. I'm sure I'm sure he's still on site because I'm in a separate room, coordinating this webinar piece. But I want to acknowledge the presence of Councilman Edward Pollard and, all the elected officials that are always supporting the initiative that we have ongoing here at Texas Southern University. And with this, I want to say thank you to all the attendees that have joined us in person and as well as those that have joined us online. I will be remiss if I do not pause to acknowledge our team members. Ziomara Adon, she is the program manager for the Texas Southern University Breast Cancer Screening and Prevention Center, as well as Azib Yusuf, who is the project manager for the community engagement call. These two ladies have been incredible, and they pulled all the resources together to make today's program a success for all our sponsors, all our vendors, all attendees in person and online. I appreciate you for connecting with us today. Thank you very much, Michelle, April, and Aisha. This is incredible. I am so excited that you guys have led us into your story, and we are making a difference. We are making an impact. And I do look forward to connecting more with everyone and making a significant impact addressing breast cancer health disparities. So thank you very much.
You're welcome.
All right. Thank you all. You have a great afternoon.
Bye.
Thank you. Bye, ladies.
Bye.
Thank you.